This is going to be chapter 2 of Goodman called Behavioral, Social, and Environmental Factors That Contribute to Disease and Dysfunction. So again, as we discussed in chapter 1, you have different models of health. You have your biomedical, biopsychosocial, spiritual, and the socio-ecological. So the biomedical is more that cellular level, that organ system level, and how diseases progress over time. Biopsychosocial model is our biology combined with the psychological issues or the social factors that happen in our lives. The biopsychosocial spiritual model is just taking that one step further and adding on that spiritual component. And then social ecologic is the different levels and how they interact to influence a person's overall health. You have variations in your client population that depend on 6 different things, and those things are sociodemographics, health status, geographic variations, race and ethnicity, age and aging, as well as gender and sex. Lifestyle factors that influence health include tobacco use, the increase in blood pressure, increase in BMI, increased cholesterol, decreased fruit and veggie intake, alcohol consumption, and lack of physical activity. Physical activity and fitness are considered 2 different things. Your physical activity is when your body's in motion, and that motion is produced by your skeletal muscles, and that they're going to expend a certain amount of energy. And physical fitness is how well somebody performs something, such as physical activities like aerobic fitness, endurance, strength, or flexibility. And then morbidity versus mortality. So morbidity is when you have moderate physical activity that can help to prevent morbidity. Exercise training can also prevent 1% of bone loss per year. Aerobic resistance exercise is associated with a decrease in the risk for type 2 diabetes, and we should exercise at least 30 minutes daily. Mortality, so there's an increase in physical activity by 1,000 kcal per week, or one metabolic associated with a 20% decrease in overall mortality. Physical activity recommendations include exercising for at least 30 minutes every single day, 2.5 hours of moderate physical activity, and muscle and bone strengthening exercises 3 times for kids and 2 times for adults a week. Older adults should focus on their overall exercise, but they should mostly concentrate on maintaining their overall balance to reduce that overall fall risk. And then obesity. So obesity is when your body accumulates an excessive amount of fat, and this causes different things like chronic illnesses or diseases, and early deaths or mortality and morbidity. Bariatrics is a branch of medicine that studies obesity, and things that measure somebody's obesity include BMI, waist circumference, waist to hip ratio, and a BMI that's over 25 kilograms per meter squared is considered obese. Obesity etiological factors are the highly processed foods, lack of access to grocery stores, metabolism decreasing, corticosteroids make the body less able to absorb blood glucose, and pathogenesis, so the CNS-mediated neuroendocrine dysfunction, hormonal dysfunction affecting the hypothalamic pituitary adrenal axis. In clinical manifestations, this will cause things like diabetes mellitus, asthma, shortness of breath, increase the risk for falls, increase incidence of hip and knee and back pain, lower extremity lymphedema, complications in pregnancy, nephrotic syndrome, renal vein thrombosis, digestive tract disorders, pulmonary compromise. And then medical management, maintain a healthy weight, maintain weight loss, and prevent weight gain. And then you have diagnosis, so again, the waist circumference increasing more than 40 inches for men and 35 inches for women, skin caliper greater than 1 inch, bioelectrical impedance analysis. And then treatment for obesity includes keeping energy expenditure at or above energy intake. So basically, you're going to burn more than you're intaking, and decreasing your calorie intake while increasing your energy expenditure. 10% loss in body weight improves your overall health, and things like drug therapy and bariatric surgery will help to treat obesity. Then the next topic is abuse. So there's different types of abuse ranging from physical, sexual neglect, stalking, child, and intimate partner, as well as elder. So physical, those are things like hitting somebody, causing them bruises, doing things that, are very physical in nature that are not an accident. Sexual, touching somebody in inappropriate ways, rape, molestation, or forced use of a child from an adult. And neglect is when you don't provide proper care, food, shelter, clothing, hygiene, emotional support to somebody. Stalking is when you're constantly, you're looking at somebody, you're close to them physically, you are communicating with them and they don't want to be communicated with, you're causing threats, you're instilling fear in them. And then child is when you are not taking care of a child, or you're doing something that's very sexual in nature to them, that's causing them some type of physical or emotional abuse. Intimate partner, so obviously doing something that your partner is not approving of and you're taking advantage of them. And then elder is when you're neglecting somebody who is an elderly person, causing them harm that shouldn't be caused to them, or you're trying to take advantage of them for things like money. Stress is very common in people who are those type A personalities. So, the ones that are very uptight, they have to do things a certain way. If things aren't done that certain way, then they're going to freak out about them. So it's a neurophysiological, hormonal, and behavioral issue, and it causes muscle tension, pain, restlessness, irritability, fatigue, startled reaction, breath holding, hyperventilation, tachycardia, palpitations, and sleep disturbances. And finally, the models of behavior. So you have health behavioral, reasoned action, and planned behavior, trans-theoretical, and social cognitive. Health behavior is when you see that somebody has a certain disease or a certain illness, and you're trying to avoid that disease or that certain illness, and you're taking your steps to prevent or to limit that certain thing from happening to you. Reasoned action and planned behavior is the way that we think of our health, like the attitudes that influence us, that affects how we're going to act towards a specific thing. Trans-theoretical model is the 7 or 6 step model of how a person's going to change over time. So you have different phases like pre-contemplation, where you're thinking about doing something, contemplation, deciding if it's still going to happen, preparation, preparing for it, action, it's taking place, maintenance, obviously maintaining it, and termination, you're no longer doing something. Then the social cognitive theory is the idea that children are going to learn something by watching that specific behavior and receiving rewards for it. That's going to reinforce that specific behavior from happening, like when Pavlov did that thing where he had the dog hear the bell and he knew that the food was going to come out, so they obviously were acting good when they heard that bell, but when they realized that the two things were connected, you were obviously going to see that good behavior. Then environmental barriers to healthcare. You have eating trends, grocery stores, media, less physical activity and more screen time, state-of-art kitchens, and science and campus-wide competitions. And that's the end of chapter 2.